You don't need anything fancy to wrap a leg on a horse. I mean, seriously, if all you've got is some maxi pads and maybe a couple of leg wraps, you know, polo wraps, they work good. Vet wrap is really handy. I've seen people use dish towels and some duct tape to hold it on. You just need something to cover up the wound, to keep it clean until the vet gets there to evaluate it and see if it's going to need stitches or if it's just going to have to heal up on its own. So, the one thing with leg wraps, you always got to remember when they're fresh out of the package, they're inside out. So you always have to open them up, undo them. Oh yeah, get your horse used to the sound of Velcro too. It's always a good thing. These guys really don't care, thankfully. But yeah, with these leg wraps, you always have to remember to unfold them and get them going the right way. So put your Velcro against the Velcro and then just start rolling it down your leg to get it rolled in the right direction for you. And try to keep it out of the fresh and low grass. But these are handy because these are washable. But like I said, I've had people use, you know, dish towels, you know, duct tape, which you don't want to get the duct tape on their leg because that hurts like crazy when you go to peel it off later. But yeah, after you've washed the leg, we'll just assume that he's got a cut right here in this area here, right here on his cannon bone. So typically, what I do, depending on the size of the cut, you know, get it hosed out real good, get your maxi pad ready, and depending on the size, sometimes you have to cut these in half or maybe just use a third of it. We're going to assume he's got a big one. But these are great because they have the little sticky thing on the one side. Hey, get out of there. I need your help. Make sure you're somewhere safe so that the horse isn't going to kick you. And we'll just assume his cut goes across here. So we're just going to put that on there. Ooh, buddy. Good boy. Hold it with one hand and then use your... Yeah, and you're going to pick your foot up, aren't you? You're going to be a pest. Good thing you're not injured. Try to get all the wrinkles out. And you want to go a little bit below the wound, you know, and cover about half. You know, so your each layer is about half the distance up of the next layer. And you want to get it snug because you don't want it falling off. But basically it's just to keep that maxi pad in place until the vet gets there to just evaluate it. Because this is really easy to take off. You know, it's not going to be real hard. Like sometimes vet wrap gets too tight. Hey, between my fence. Stop it. But that'll stay on. It'll keep it clean. It'll help absorb any moisture that's coming out of the wound until the veterinarian arrives. And you can do the same front leg, back leg. If you have a wound that's up higher, sometimes you try to put a wrap here, it's just going to slide down their leg. So sometimes what you have to do is you have to put a lower leg wrap on and then follow with an upper leg wrap. So since we got the lower one on, I'll just put another one up above it to demonstrate. Don't eat my fence with that, girl. You know, get your horse used to having his legs wrapped. You know, work with it, get it used to stuff being around his legs. Because the more you can do when your horse is healthy and normal, the easier they'll act and the less stressed out you and they will both be when it comes time to having to do an emergency. So, you know, you got your lower leg wrap on and then you can just use that to build up from there. Sometimes you even have to put two on to get that thick enough. Then you can just wrap. So say if his wound was right here, now that would help keep it on. And again, you want to do it nice and snug, keep any wrinkles out. You know. Hey, quit bugging me. You know, and that way it'll keep that. Hey, stop eating the fence. Oh, you look so pretty in pink, don't you? This poor fella. Stop eating the fence. It's bad. Bad girl. Trying to think what other common emergencies do we see. Colic is common, so like I said, get a heart rate on them. Check mucus membrane color. Oh, check hydration status. Pinch the skin right here on their neck, and then also too right here on the front of their shoulder. Typically this one will go down a whole lot faster than the neck one. You're kind of hot, aren't you? But you know, as long as it goes down within a few seconds and then this one flops right back down, they have good hydration. You know, check heart rate, take a listen to their gut sounds. You want to listen with your stethoscope, or even just put your ear next to them, you know, up in this area here, and then down in this area here. And this is something else. If your horse is a ticklish horse, get them used to having their belly messed with, because the vet's going to want to be able to hear their belly, you know, in this area as well. And if they're ticklish and kicking at their belly, it's not exactly a fun process. But do both sides of the horse, because that's got important information as to what intestines are at which side. We talked about getting their temperature, you know, front leg versus back leg. You know, some horses tend to be a little bit more sensitive on their back leg than their front leg, so get them used to being touched. You know, a lot of it's just preparation time for the just in case moment. What other things? Oh, other common emergencies I see is a choking horse. One that has decided to swallow its food and get it stuck in its esophagus. Note that their esophagus typically runs down the left side of their neck. So quite often you can either see the bulge, you know, it might be anywhere along here. Sometimes it's right here at the thoracic inlet. But what you can do is encourage your horse to lower its head. This is something that obviously I haven't taught mine to do. But, you know, try to keep their head down and then just massage their neck and see if you can break some of that crud up. And they should have all kinds of nastiness coming out their nose. You know, a lot of times you can relieve a choke just by getting them to put their head down and massaging their neck, and they can cough that out or they can get it out their nose. You know, that's something where you don't want to let it go for more than an hour, because they're continuing to try to swallow, and eventually if your blockage is right here, they'll keep swallowing their spit until finally it builds up to here, and then next thing you know, they're breathing their spit down their trachea, and then they end up with pneumonia. So choke is something you don't want to let it go for very long. You know, if you see your horse who's eating and all of a sudden he's like coughing and gagging and uncomfortable, you know, stretching their head out, you know, putting their nose up, you know, yawning, you start seeing feed particles coming out their nose. Those are classic signs of a choke case. Another thing I often see is eyelid lacerations. These guys are crazy. I don't know how they do it, but so many times they'll be in a stall or they'll come in from a pasture and they'll catch their eyelid on something, so this upper eyelid will just be hanging. It'll be a dangling flap. You don't want to cut that off because they need their eyelashes. So, you know, the best thing to do is if you can get a cold ice pack and just put on their eye, that'll help a lot with the swelling. Obviously, call your veterinarian. We'll explain to them, hey, look, my horse cut its eyelid. And then you can tell them, you know, yeah, it's bleeding a lot, or, you know, it's pretty well stopped bleeding. Most of the time, they really don't bleed that much. There's not any major vessels up in here. But yeah, an ice pack helps. It'll just help get that swelling down. You know, and most of the time, if you keep your hand on the horse, that way if they're moving their head around, you're moving with them and you're not going to whack them in the head with the ice pack. That wouldn't feel very good. But that can get the swelling down. You really don't want to try to wash it too much, because then you're just going to break off the scab on that piece of eyelid, and when the vet comes out, they'll be able to sedate the horse enough and, you know, numb their cornea so that any soap that they use on their eyelid is not going to cause problems with their cornea. But the biggest thing is do not cut that flap off, because then you're removing their eyelashes, and then you can end up with a blind horse because they can get a corneal ulcer because they can't blink properly. Let's see. Depending on, you know, a lot of horses get cuts and bumps and scrapes. Most of the cuts on the face, they actually heal up pretty good. They're easy to stitch up. So quite often, you know, if you get that horse that bops its head up, just like he just did, and he nails it on the trailer, you know, they get these nice cuts up here on their forehead. Again, ice pack, you know, wash it with you know, cold water. And then, you know, call your vet and say, hey, my horse cut his head, it needs some stitches. But, you know, just the basic, clean it out, get the swelling down. That'll do a world of good. I have seen a few horses just get their nose into things they shouldn't have, and like cut their nostrils or get their lips stuck on something, you know, cut their lip, and most of those things heal up with a few well-placed stitches. And a lot of it's just, you know, clean it out, soapy water, you know, mild soapy water. Get ice on it because that helps knock the swelling down. What other common injuries? Eyelids.